Hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel. This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, from the title of this thumbnail, it says here I'm gonna show you how to pass your evidence-based practice. Evidence-based practice is a station in which you will have to write. As you all know, evidence-based practice and professional values are new stations that has been added since last year 2022. So yeah, according to this thumbnail, I'm going to show you how to write your evidence-based practice. Again, it's a silent station, so all you have to do is, yes, write. First of all, you are given 10 minutes for this procedure. Just to be clear, professional values and evidence-based practice are almost similar to each other. They both have different topics. But what I like about evidence-based practice is you are given topics and then you have to analyze the studies given. Previously, when evidence-based practice and professional values was introduced early on, there was only few of them. Namely, diabetes, female myocardial infarction or MI, pressure ulcer prevention, smoking cessation, and the use of honey dressing for leg venous ulcers. But since November 2022, more of this evidence-based practice have been added. Okay? So we're gonna tackle one by one here in this channel. So before I start today's topic, I would want to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Oh yeah, more or less I'll be posting on the membership side in which I will give you more of the answers. So if you want to get all the answers, please do click the join button and become a member. So all your questions will be pop up to the top and I'll be able to answer your question as soon as I can. Okay? As soon as I can. Life is really busy at the moment. Okay? Anyway, let's go back to the topic. These are the new topics that NMC have added into the evidence-based practice. We've got ankle sprain, bedside handover, Asperger's syndrome, cervical screening, cranberry juice and urinary tract infection, dementia and music, fever in children, restraint, saline versus tap water. As you can see, it's now more. Okay? So, before we head into it, I'm just gonna give you a quick briefing. So, you will be given a scenario. It doesn't matter what kind of scenario we're given to you as long as you follow the marking criteria. As we all know, marking criteria is the Bible for your Osce. And it's the only way for you to pass the Osce exam if you follow the marking criteria. But don't worry, as we go along through each and every topic, I'm gonna flash you the marking criteria for you to study. Still, if you wanna know more, you can go to the NMC website, okay? I'm gonna flash it here in this screen. So, what is evidence-based practice? To those of you who are new learning Osce, evidence-based practice, in the framework for this one is that you will be given a topic, you will be given a scenario involving a patient, more or less you will be given a studies, and then with the result, and then with a conclusion. So you will be given that scenario, and at the back, you will see this. You will have the answer sheet in which you're going to write your answers. So in here, following the marking criteria, you have to write the relevance of these research findings and of course, the advice that you are giving to your patient. So basically, EBP or evidence-based practice, including your professional values, anyway, side note, tangent, not the point, they are both written in a future tense. So always make your sentence in a future tense, okay? Clear? So for today's video, we're gonna tackle one of this evidence-based practice topic. And yes, you are right. According to the thumbnail of this video, we're gonna discuss ankle sprain. Are you ready? Let's go. Now we've come to our shout-out section. Congratulations to Alexis E. Magay, ang Biswaray in the UK. Thank you so much for your very lovely video. Congratulations. Welcome to the team at G4967. Oh yeah, welcome to the team at Ayuchi Uzor. Again, paracetamol and codeine are not the same. Check the BNF. Last shoutout for today at DG Kushwaha. Thank you so much for joining the team.